actually went to a very unusual leadership retreat, probably in 2011. And it was talking about actually building your legacy. And, most retreats or leadership developments programs you go to, they maybe build a skill here or there. But this was really a program that said, if you are at the height of your influence, what are you going to do to put that influence to use to actually create a greater impact? Women often do tasks that are put in front of them instead of doing things with a purpose and for a purpose. And how do you actually have a very purposeful way of making decisions in your life and also living into the future that you imagine for yourself? So this is really an imagination exercise that women leaders go through. Now, I was the only healthcare woman there. I was with women from Microsoft and Dutch Oil Shell and Google. And I thought, wow, I bet I could pull together a group of women that want to think about fixing healthcare as much as I do. And so I wrote to the Robert Wood Johnson Foundation. We got a small grant to actually bring 23 women together in 2013, calling ourselves Women of Impact. And these women went through this imagination exercise. And for many of them, and these are national leaders, they said it's the first time they had ever thought about their careers in that way. And it was transformative for many of them. And they have all stayed incredible friends. And actually, we said, how can we actually increase the number of women that can experience this? So we've had 4 cohorts thus far. Now, we don't want to be a really large organization, but right now we have about 70 women that have gone through the legacy exercise. And we meet, we're actually on the phone about every 3 weeks, talking about how we're going to create greater impact, but we're all focused on really contributing to fixing healthcare, because we all have different perspectives, but healthcare is broken in a lot of different ways. And there's probably not one solution, but there's great strength of us all working together.